I have one question that's just occurred to me. I don't know if you're aware of Malcolm Kendrick, GP, who talks a lot about statins.
Oh, yes.
In fact, he's annoyed most of the conventional medical profession because he's pretty damn hot on the research and so on.
Yeah.
But he's one of the things that he has argued is that the questioning which is applied by the medical profession to someone who comes in who is on statins doesn't really assess what the effects of the statins are. Because they'll say things like, are you okay with your drugs? And the person will say yes, but they don't do anything objective.
No.
Are any of these tests that you apply, are you likely to be able to attribute, not to statins necessarily, but to pharmacological influences or anything like that? Would that be part of the assessment?
I can make assumptions, but I guess the statins, the obvious one is the inhibition of coenzyme Q10, and then the lack of mitochondrial function. So you tend to see with that, because the brain is consuming, 20% of the energy, that's going to be one of the first areas you see problems. And that tends to be in the inhibition areas. So the pre-frontal cortex, the Purkinje neurons in the cerebellum, which are inhibiting movement. So, excuse me, we don't get too much. And areas of the basal ganglia, again, which are kind of inhibiting additional movement.
So who's going to notice this, the partner rather than the person with the problem?
Well, again, will they attribute it to it? Because they might.
But they might say to you, "There's a problem with my partner." They won't know what it's caused by.
I saw one chap last year, and his balance was getting worse and worse, and walking was a real issue for him. He had an increasingly ataxic gait. So I started doing some rehab, which was helping a bit, but then the partner brought up the conversation about, well, he has been on these for the last 2 years, and then we look at the timeline and think, maybe there's something in this. Obviously can't say, well, go off them, but say, well, maybe it's worth going to see GP or pharmacist and discussing these symptoms, and are they connected with it?
Yes.
So they did have a trial off.
I always shove a copy of Malcolm Kendrick's book under their faces and say, you might want to read this book. I can't tell you to stop your statins, but this bloke would.
Yes. He's a doctor and that's okay.
Exactly.
Yes.